Now the second part, series of bone physiology, we're going to talk about bone remodeling and repair, and specifically its control in an attempt to maintain homeostasis of calcium levels. So first, I want to give you a couple terms to remember that are involved in bone modeling or bone remodeling. Bone resorption. Do not confuse it with reabsorption. So if I say bone resorption, that indicates I'm referring to pretty much bone degradation or breakdown. So you're breaking it down. Bone accretion refers to when you're building bone. So we'll just say bone building. The term accretion refers to any time you're making something by putting, what's the word I want? Parts together. So you're just building up bone. So bone accretion is building it up. Resorption is bone degradation. And bone resorption, we'll write it here, the big thing involved in that is the osteoclast. Bone accretion would be our osteoblast. So osteoblast is our builder. Osteoclast, I think the C, think catastrophe, you're breaking it down, like if you remember catabolic, if you remember catabolic type reactions, things are being broken down. So the first thing I want to look at that's going to be involved in bone remodeling is first got to talk about the skeleton as a calcium reserve, because blood calcium levels are a very important component of bone remodeling. Most of your body, total body's calcium is found in bones. But there are a number of different organs involved in maintaining adequate blood calcium levels. Bones will be one, because that's a huge storage. Your gastrointestinal tract, specifically mainly your small intestines, and be involved in absorption of calcium from your diet. And the kidneys, this is a place where we can regulate the amount of calcium that we keep in or excrete. So those are the three major things involved in calcium ion concentration. Now, indirectly, the skin, you may bring the skin in, because we had talked about in an earlier time is the role of UV radiation and forming vitamin D, or specifically vitamin D3, and that's going to be a precursor to something called calcitriol, which is going to be involved in calcium balance, but we'll talk about that very shortly. So here, first thing we're going to look at is the scenario where you have blood calcium levels have gotten a little low. That's not a good thing. It's going to mess with your nervous system. It's going to affect your ability to blood clot. It's going to affect your ability for muscle contraction. It's involved in regulation of enzymes, so we don't like this. So we need means to get that blood calcium levels back up. The hormone that's going to play a major role in getting blood calcium levels back up is a hormone called parathyroid hormone. Parathyroid hormone, which you see is abbreviated as capital P, capital T, capital H. They're produced by the parathyroid glands, which are glands that are found on the back aspect of the thyroid gland. So para kind of next to, nearby the thyroid glands. Well, when blood calcium levels get too low, parathyroid hormone is going to be released. And you'll notice some of the things it does. You see these big old osteoclasts here, and you see it's kind of eating away at the bone here. They're going to be activated or stimulated to start releasing its enzymes and the acids to help to break down the osteoid, the organic component of bone, and to release the calcium and the other minerals that are in bone. Obviously, the main thing we want to get to is calcium. But I'm going to mention very shortly, I'm going to say, well, calcium and phosphate really like to hang out together. So phosphate's going to be released too. But this is the issue. What we're regulating is calcium in this state, free, not bound to any proteins, not bound to any other ions. So it would, if it bound to calcium or phosphate, calcium phosphate, we don't like that. I want calcium by itself in the blood, because that's going to be what's going to be important for different reactions in the body. So I'm getting calcium out, I'm getting phosphate out, but don't worry, I'm going to get rid of that phosphate. I just want to keep on to the calcium. Other thing that parathyroid hormone is going to do as you say here, in the kidneys, it helps you to retain calcium ions. So in the kidneys, you filter blood, the good and the bad, but we're going to make sure that we keep in or reabsorb as much calcium that we can. So it does is it, I'm going to say plus is it stimulates calcium reabsorption. That's really what it does. There's going to be certain parts of the nephron tubules that it binds to. The other thing it does is we'll just put increase calcium reabsorption. It also increases phosphate excretion, because I don't want that phosphate to bind with the calcium, so we're going to get rid of it. So parathyroid hormone is going to allow me to do that. The other thing that parathyroid hormone does is in the kidneys, it increases calcitriol formation. And calcitriol over in the GI tract here in the small intestine it increases the absorption of calcium from the GI tract, which what I would want. So it's through it says parathyroid with calcitriol. It's really calcitriol. So if blood calcium levels get low, parathyroid hormone is going to cause effects to get that calcium back up. We're going to break down bone. We're going to make sure at the kidneys that we reabsorb any calcium that was filtered. We're going to produce more calcitriol. Calcitriol is going to make sure any calcium that you're taking in through your diet, we can absorb it, because calcium is actually poorly absorbed. So it's going to increase the absorption of calcium from the GI tract. Now calcitriol, as you've seen this picture before, is the formation of it actually takes place in the kidney, but the precursor for it is ultimately cholesterol. But here, you've heard of vitamin D3. And vitamin D3 can be formed in the skin, in the epidermis of the skin, in exposure to UV radiation. But vitamin D3 is not the active form. But what we can do is through a series of different steps that you can see in the picture, eventually this is the term for calcitriol, 1,25-dihydroxycholecalciferol. I think it's easier to say calcitriol. Some people pronounce it calcitriol. I don't really care how you pronounce it. But parathyroid hormone activates or stimulates the formation of this, actually it's a hormone, I'm not even going to call it a vitamin, it stimulates the formation of calcitriol, and its major action is here in the gut. Okay, it's going to be here in the gut. But overall, what calcitriol does, it does increase calcium and phosphate, because you'll see here what's going to do. In the gut, I had mentioned what it did because of when we talk about parathyroid hormone. It increases calcium absorption, but it also increases phosphate absorption because they kind of like to hang out together. In the kidney, calcitriol increases calcium absorption, but it's not going to have as much dramatic effect as parathyroid hormone. The major thing calcitriol targets is the gut, but it does increase calcium reabsorption, I should call it reabsorption, in the kidney, and it does decrease phosphate excretion. You're like, oh my gosh, you just lied to me. So we talked about parathyroid hormone and what it did, and it said that increased phosphate excretion. This one decreases it. The one that's going to win out, is parathyroid hormone. So don't worry. Anytime you really need the calcium, we're going to make sure you get rid of that phosphate. Now in the bone, vitamin D is needed for normal bone growth. It works with parathyroid hormone to help to increase resorption of bone, but in small amounts, it actually is needed for bone formation. So it all depends on the levels of it. So that one's tricky, but I want you to remember is its role in the gut. It's to increase calcium absorption. That's the big thing I would like for you to remember. And also kind of know that parathyroid stimulates its production in the kidneys. That's where calcitriol is formed. Now the other scenario is, what if blood calcium levels are too high? And I'm going to show you here, you see this hormone here, But the thing is, I'm going to downplay it right now. In an adult, calcitonin does not play a huge physiologic role in adults. The reason why is, well, calcitonin is a hormone produced by the thyroid gland. Okay, so this is produced by the thyroid gland. People who have their thyroids removed will need thyroid hormone replacement, T3, T4, but they never need calcitonin replacement, and that can be perfectly fine. They believe calcitonin plays a more important role in early development and not as an adult. If your blood calcium levels are too high, your parathyroid hormone levels are going to be really low. But we're going to talk about calcitonin just because it does play a role when you're very young, but also calcitonin can be used therapeutically if someone has dangerously high levels of calcium in their blood. So calcium pretty much does the opposite stuff as parathyroid hormone. So you notice here the osteoclasts are inhibited. I don't want to break down bone. I got plenty of calcium. It helps the osteoblasts have enough calcium. Hey, osteoblasts, take it in. Make some, just trap it in the bone. The calcitonin in the kidneys will allow calcium to be lost. It's not going to increase reabsorption. So you'll filter calcium, but it's not going to be taken back up into your blood. It's going to end up out here in the urine and in the toilet. There's my picture of the toilet. Okay. The high levels of calcium will also decrease parathyroid hormone, which would decrease calcitriol formation. So you're not going to be absorbing as much from the GI tract. Where this becomes important in an adult is if you come in with extremely high levels of calcium. One thing they can give you is salmon, the fish, calcitonin. They've derived it from salmon, and that can be used to try to get the blood calcium levels down to a relatively safe level so they can figure out what's causing the high levels of blood calcium. Now, the last couple of things I want to discuss is some various things, some hormones, some vitamins, things that can affect your bone growth and repair. Thyroid hormones affect it, growth hormones, certain vitamins, if you're deficient in them, can affect it. Not enough calcium, if you're inactive, all these things can somehow affect bone growth and repair. So let's just kind of go over maybe a couple of them. Oh, sorry, I missed 1 second. Okay, so vitamin D is, we really talked about earlier, because vitamin D is your precursor for calcitriol. So you need that to help with calcium absorption in the gut and all the other effects that I had talked about. Now, vitamin C is needed to make collagen. So it's very important for collagen formation. Remember, collagen is a very important organic component of bone. So collagen helps to kind of keep that tensile strength of bone. If you want to look this up, scurvy is a result of a vitamin C deficiency. So I want you to look up scurvy and tell me what are some of the signs and symptoms of scurvy. And why did they call sailors limeys? So why did they call sailors limeys? Okay. All right. Other vitamins. Vitamin A, you can read what's in your notes. B12, you can read in your notes. Big ones, vitamin D, vitamin C that I always think about. But there's other vitamins that play a role. Now, hormones, because I'm an endocrinologist by training, of course, I love talking about the hormones. Growth hormone is a normal hormone for just normal growth. It is a hormone produced by your anterior pituitary gland. If you oversecrete it at a very young age, you're a giant. There's a thing called gigantism. If it's very undersecreted when you're young, it can lead to dwarfism. Insufficient amounts, not necessarily dwarfism or gigantism, can affect your true stature. One of the things it does, it helps with the osteoblasts and the chondroblasts. So it is involved in just normal bone growth. Sex hormones, the estrogens and testosterone, I had mentioned those earlier. So you can read your notes, and I've discussed them earlier. Insulin is a normal anabolic hormone. Most people talk about insulin as saying, well, insulin is when your blood glucose levels are high. It allows your cells to utilize that glucose, take it in and use it for energy or store it away. But just think about it. In order for you to grow, you need fuels to grow. Insulin's going to be needed for body cells to utilize various nutrients like glucose, and it's also needed for normal protein synthesis. So insulin's a very important one too. Growth hormone and insulin work very, very well together. You will not get proper growth hormone function without insulin also. The other one is thyroid hormones. You think more, when people think thyroid hormones, they think metabolism, which is exactly what they do. They're very important in metabolism. They're important in pretty much every process, metabolic process in your body. You also need these for normal bone growth. They, one of the things that to be wary of is too much thyroid hormones can cause excessive turnover of the bone. And if you turn over the bone too quickly and you don't match it up with trying to build up the bone again, that could predispose someone to osteoporosis. So anybody who's had periods of being hyperthyroid, their chances of being osteoporotic are greatly increased. So if you had hyperthyroidism and it was treated, and then you're in thyroid hormone treatment, you're still at risk because you had a period of being hyperthyroid. Plus also while you're in thyroid hormone treatment, until they're getting those, checking those the levels, there can be periods where you're hyperthyroid there too. So chances of loss of bone are elevated with people who have been hyperthyroid. So thyroid hormones also play a role in bone growth. So this is going to be the end of the webinar on bone histology and physiology. And so we'll do a little review next time.